Coronavirus public health emergency is over. The CDC bringing the order to an end this week. We're going to take a deep dive on the impact this will have here in the state of New York. Hi everybody and welcome to Empire State Weekly. I'm Ryan Peterson here in Albany. The COVID-19 national emergency is over 3 years after it was declared back in March of 2020. The change will mark a shift in how the state responds to the virus, of course. The change set to have several impacts, like vaccines and tests will no longer be paid for by the government. The price will now vary based on your insurance coverage. Federal food programs, including SNAP, will once again have work requirements within them. One notable requirement that so far is not changing is the vaccine mandate for healthcare workers here in New York State. Joining us now to give us some great inside details on the changes in the state's response to the coronavirus is Acting State Health Commissioner Dr. James McDonald. Dr. McDonald, thanks so much for giving us some time.
Oh, great to be with you today. Thank you so much.
So 3 years ago, March of 2020, this emergency order went into effect. It is now done with. It seems a little surreal, doesn't it, that it's finally come to an end here?
Yeah, almost anticlimactic is the word I'm looking for, though I do like surreal as well. You know, it's not lost to me how all of us have gone through something. You know, it's not just a population trauma that all of us experience. We all have our story. You know, everybody has a pandemic story, and you know, quite frankly, it's affected all of us.
Absolutely. And for a lot of folks out there, it's important to point out that even though the emergency is over, that emergency order, COVID is still here and is still very real, and it most likely will be with us forever, is the consensus, correct?
Yeah, I don't see an expiration date on the actual virus. You know, it's here. We've had coronaviruses before, by the way. So in other words, as far as I'm looking at this is just another coronavirus we have to learn to live with. But the nice thing about this one is we have treatment for it and we have a vaccine for it, which, you know, we didn't have that 3 years ago. So those are positives.
Well, absolutely, and especially after the millions around the world who are unfortunately lost to it. What is one of the biggest changes here, Dr. McDonald, in the state that people will notice right away?
You know, I don't know that you're going to notice a lot of changes, quite frankly. When you really think about the end of the, you know, federal emergency, it's like the vaccine's still available, treatment's still available. So those are available till we run out of that supply. The big change I think you're going to notice, though, is that free testing isn't available anymore. And so that's something where to be covered by your health insurance. But that's one change you will know. That's the big thing that I can think of.
And when we talk about one of the biggest issues our healthcare providers face throughout all of this was staffing, and it still remains an issue for a lot of hospitals and a lot of doctors' offices around this great state of ours. The mandate for healthcare workers to be vaccinated is still in place here in New York. Do you imagine that that is something that will be revisited now that the emergency is over? How are you going to look at that here in the immediate future?
Yeah, you know, the healthcare worker vaccine mandate is in regulation. So in order for it to change, that has to change. And so I'm willing to take a fresh, holistic view with that regulation. You know, look at where we are now, definitely recognizing where we've been and where are we now and what makes best sense for the health and wellness of all New Yorkers. So I'm open to see what's possible.
The CDC says they will no longer be tracking each and every individual case of COVID now. A lot of our county health commissioners have said they will kind of follow that lead. Is the state going to be kind of taking a similar approach?
Yeah, what we're looking at now in hospitalizations, I think they're the best metric we have to keep track of how much COVID is affecting us right now. And I'm pretty confident that's going to be a metric that's going to ride us through for the foreseeable future.
And for people that are concerned, we know there are still people at this very moment, certainly not in the numbers that we saw in the height of the pandemic, but there are people right now in the hospital that are dealing with COVID-19.
Yeah, you know, and I think that's an important thing to remember. Like other infectious diseases, people are still going to get this. And one of the things about COVID is it's not seasonal yet. In other words, I think we're used to a cold and flu season. Well, COVID is really, you know, present all year long. Sure, we've seen nice trends as far as cases go, but it's really not a seasonal disease yet. This is why I encourage people to think about this a little bit differently. This is a preventable disease, you know, and State Health Commissioner, no surprise, I want you to be up to date with your vaccine like I am and my family is. The other thing, though, is if you got sick with COVID, avail yourself to treatment. Talk to your healthcare provider. Let's see if treatment's right for you, because really, I'd like to keep people out of the hospital. I want all my New Yorkers healthy and doing well.
The numbers at last check coming from you guys, more than 3/4 of New Yorkers have completed at least their primary series of the COVID vaccine, and roughly 14% up to date on those boosters. Would you like to see those numbers come up?
I really wouldn't. I think one of the things I want people to think about too in particular is if you're 65 or older, your risk of having a hard time with COVID is much higher than someone much younger. If you have underlying medical diseases, your risk is much higher as well. So if you're in that group, you really need to look at why haven't I gotten the bivalent vaccine? Why am I not up to date? Sometimes it's just, quite frankly, haven't gotten around to it. Pharmacies are ready, willing, and able to do that. And I think it's one of those things where, soon isn't the time, hope isn't a strategy. Today is a good day to get up to date with that bivalent vaccine.
Masks were awfully controversial during all of this as well. We know most doctors' offices and hospital settings do not require patients as they're coming in to wear it anymore, although it might be recommended. As far as mask wearing as we continue to live with COVID down the road, do you ever see a mandate coming back, or will it simply be something that is just highly recommended moving forward?
Yeah, the strategic direction where I'm headed right now as I foresee our future is really more towards telling people what's going on, helping them make the right decision. I don't know that we're heading towards mandates towards the future. I really don't see that in our future. What I really see more so is, myself and my team will tell you what's going on, what will help you, and then help you make the right decision for you. Because I tell you, when COVID gets to be more prevalent again, you will see me wearing a mask, and when I'm in settings that are high risk. When it's really low like it is now, you won't.
The vaccine, again, we've talked about no longer being free, no longer being paid for by the federal government. Now going through your insurance company. Prices may vary for people depending on their coverage. Those home test kits, and there were a lot of them out there, will those continue to be available for free as long as the supply is there? I know a lot of the county health departments say that will certainly be the case.
Yeah, that's right. In other words, while there's a free supply out there, we're going to give it. But what you're going to see is eventually that free supply is going to be exhausted, and then people have to rely on their health insurance or quite frankly, pay for it. Unless there's something changing from the federal government, which I haven't heard is going to happen.
As we move forward, is it still kind of the directive of the state of New York to kind of follow, obviously, the CDC's lead here and their recommendations?
Yeah, generally we're aligned with the CDC and what they're doing, because I think right now this is into a regular, preventable, controllable, treatable disease right now. I think people generally have an idea of what to do, right? If you're sick, stay home. If you haven't been updated the vaccine, let's get updated the vaccine. If you do test positive, talk to your doctor about treatment.
And you've mentioned it once already before, but I think it's worth repeating. People that are relatively healthy, I like to include myself in that category. I have been through COVID, and for myself, it was minor. It was just like having a cold. But as has been pointed out repeatedly, those that are older, those that are immunocompromised, it can have a serious effect on your health and put you in danger.
Yeah, and I particularly want to just call out my 65 and older crowd in New York State. When I look at who ends up in the hospital, a lot of the people who enter the hospital are 65 and older. And I think that's really one of those things to just keep in the back of your mind is, if you're older than 65, is you really want to be up to date with the vaccine, because that really does help you. Or in addition, if you do get COVID, talk to your doctor about treatment, because people who are 65 and older or have those underlying diseases really don't do as well with this disease.
Acting State Health Commissioner Dr. James McDonald. Dr. McDonald, thank you so much for your time. We really appreciate it.
My pleasure.
All right, we're continuing to follow the impacts of the end of the COVID public health emergency. Coming up, we're going to speak with the president and CEO of several major health systems here in New York State to talk about what the change means for healthcare workers and those that are seeking care. Welcome back to Empire State Weekly. I'm Ryan Peterson here in Albany. The coronavirus has wreaked havoc on the healthcare system in New York and the entire U.S. for that matter over the past 3 years. Healthcare workers were on the front line seeing the worst of the pandemic. According to the New York State Department of Health, more than 6 million cases have been confirmed here since March 2nd of 2020. Nearly 80,000 New Yorkers lost their lives due to the virus. More than 3/4 of New Yorkers have completed at least their primary series of the COVID vaccine, and about 14% are up to date on their boosters. And joining us now to give us some insight into how our major regional healthcare networks are adapting to the new and unprecedented challenges in the wake of the COVID pandemic is Dr. Stephen Hanks, President and CEO of St. Joseph's Health and St. Peter's Health Partners. Dr. Hanks, thanks for joining us. Nice to see you.
Happy to be here, Ryan. Thank you for inviting me.
So we're talking about the COVID-19 national emergency declared back in March of 2020 now comes to an end. It feels kind of surreal in a way now that it's ended, doesn't it?
What a long, strange trip it has
Yeah.
been. From the early days where there was nothing but fear to now the situation where the virus that's causing COVID-19 has evolved to be much more like a flu or common cold type of virus. Still potentially deadly for some types of people, but no longer at a pandemic level and no longer the threat it once was. And now we have vaccines and treatments and tests. And so the end of the public health emergency really makes sense.
What are the challenges that healthcare facilities and systems face now in the wake of this? I know staffing was a huge issue for a long time, remains an issue for a lot of hospitals in the region. How are you tackling that?
Staffing really remains the huge issue. And it's staffing at all levels. Mm-hmm. And it's not just healthcare, as you know, it's a secular trend across all industries. And in healthcare in particular, nursing, techs, radiology practitioners who shoot the x-rays for us, ultrasonographers, we're short of staff at just about every level. And so we're having to adapt in various ways. We have closed beds that are offline. We have closed ORs that we're not able to operate at certain times. We have had to diminish the size of certain units. We've had to look at alternative models of care. We're looking at, for example, virtual nursing support for the nurses on the floor in a team-based model where an experienced nurse in the cloud can oversee the care and facilitate more efficiency. So we continue to adapt, but the staffing is by far the greatest. And then the second, hangover relates to the general inflationary pressures we're experiencing. So not just labor, but the price of everything, surgical supplies, all the things we use has been inflating. And we have kind of a fixed payment type of system. So we're not able to adjust our prices up as our expenses go up. So it really puts a lot of pressure on our not-for-profit health systems.
When it comes to staffing here in New York State, that vaccine mandate for healthcare workers is still in effect.
Yes.
I know the Department of Health has said they're going to be looking at everything now that the emergency has come to an end, but I can imagine that if they eliminate that may beef up your staff a little bit better, right? I assume people
I do believe that would help. And the reason I say that is we've already had queries from people who used to work for us, who we lost during the pandemic because of the mandate. They just did not want to get the vaccine for whatever reason. Many of these folks we had offered religious exemptions, but those religious exemptions were also eliminated by the state mandate. And so we lost probably 500 people in total. I don't know the exact number, but it's not an insignificant number. A number of these folks have already called inquiring, knowing that the public health emergency is ending, saying, gee, can we come back to work? We'd like nothing more than to be able to bring back former staff who have experience, who have history with us. So I do believe it would help a little bit. I'm confident that the department is looking at the mandate, and I'm also confident that they're aware of the staffing challenges that are facing our hospitals and the sense of crisis that in of itself is creating.
You talk about some of those virtual options, and there's a population out there that's a little bit older, maybe weary of things like that, these new technologies, these seeing a nurse or a doctor through an electronic device. What have you heard? What has the feedback been from people that take advantage of those services? Do they like it? Is it hard for them to understand at first?
It really is patient specific, and it's also dependent on the type of encounter. So for very routine sorts of things, telehealth works fantastic. For the more difficult, complicated patients who may have visual difficulty, multiple medical conditions, hearing difficulty, the telehealth can be a little bit more difficult. I do think, though, that telehealth is here to stay. It won't replace in-person care,
Right.
but it can supplement in-person care, particularly for some of the more routine types of things that we encounter.
The emergency may be over, but COVID is still here with us in a
Yes.
very real way. We know there are still people here in the capital city of Albany that are in the hospital with COVID. What do you have to say to people? And I know some of the state numbers that have been floated out there. I think a lot of the state health officials would like to see more people get the vaccine than currently do. What is your message for folks?
Well, we continue to encourage people to keep their vaccinations current with the recommendations of the CDC. And as new vaccines roll out, and we have no idea what the pace of that is going to be, our recommendation to the public is to acquire those vaccinations to best protect yourself. And then we're really at the point in the pandemic, though, where COVID is just part of our lives now, like influenza and other viruses that circulate on a regular basis. I don't believe it's ever going away. And so you just need to use the common sense precautions that we always use. If you're sick, you should stay home. If you're coughing, you need to cover your mouth. Wash your hands frequently. Use common sense protections. If you're a high-risk person, you should wear a mask in a high-risk situation. Like, for example, if you're immunocompromised and working in a healthcare institution, you might want to consider voluntarily donning a mask. And obviously, when we care for people with respiratory conditions in the hospital,
Right.
we're assuming they have something that's contagious and transmissible, and so we still are requiring our staff to don appropriate PPE.
And what about patients when they come in? I know there's some health facilities locally that have said if you're a patient coming in, you don't need to wear a mask anymore. Others are requiring. What is the rule now at St. Peter's?
Yeah, there are still some conditions where it makes sense to have a mask on a patient. For example, a patient with a respiratory disorder who's coughing, who's being transmitted between floors or from a floor to an X-ray area or something of that nature. If the patient can tolerate the mask, we will apply a mask. But our general rule is like it is at the other area hospitals. Patients aren't required to wear masks.
All right, Dr. Stephen Hanks, President and CEO, St. Joseph's and St. Peter's Health Partners. Thanks so much. We appreciate your insight.
Thank you.
Well, as COVID public health emergency comes to an end, so does an immigration policy that was born from it. When we return, what New York State lawmakers have done in preparation for the end of the controversial Title 42. Welcome back to Empire State Weekly. I'm Ryan Peterson here in Albany. Title 42, the pandemic-era measure that allowed the U.S. to rapidly expel migrants on the grounds of public health, has expired as well, and it's expected to have some serious impacts here in New York. Our Capitol correspondent Amel Taliji has more.
The United States has a choice. Either we're going to have a lot of illegal immigration or we're going to have a legal migration system that enables people to apply to enter legally and come and contribute to this country in a legal way.
David Beer is Associate Director of Immigration Studies at the Cato Institute. Beer says the chaos that's occurred at the border is the result of an overly restricted immigration system in the U.S.
And as long as that's the case, particularly for people without U.S. citizens who are close family members or extremely high skilled individuals, I mean, those are the people who can find a way to come. But if you don't fall into those two camps, then there's not a path for you to come legally. And that's what the administration and Congress need to address more than anything else.
State officials agree that the immigration system does need to be reevaluated. But for now, Congress has proposed Border Bill H.R. 2. Congressman Nick Langworthy explains.
It's really basically strengthening our border policies. We have to, promote our existing law. We have to support our border customs and border patrol agents, but it also, would give our customs and border patrol agents the tools that they need to enforce those laws and bring this back into focus.
Langworthy says there have been 92 people who were on the terrorist watch list that have been apprehended at U.S. borders in the last 6 months. He says this bill will keep the U.S. safer and alleviate current migration issues.
Now, the other side will tell you that it's heartless, it's cruel, it's everything. We have to protect America first. before we can help the rest of the world.
Some have pointed to the border crisis as a means for cartels to get fentanyl over U.S. borders. But Beer says that's a common misconception, and drug trafficking organizations will use legal citizens to get their drugs across.
That's why U.S. citizens are over 80% of the people convicted for drug trafficking offenses in the United States, because they have the legal right to come in. They're subject to less scrutiny, and the drug traffickers know it.
Reporting in Albany, Amel Talegi.
Our thanks to Amel. Stick around. We'll be back with a look at the week ahead in just a bit. All right, and finally from us here on Empire State Weekly, a report looking into New York's alcoholic beverage control law has been released. The commission behind that report recommending that lawmakers make changes to modernize and simplify the more than 90-year-old law. Supporters call the current liquor laws the most restrictive in the nation. Next week, we'll hear from a member of the commission itself to break down the recommendations that they've made. For now, from all of us here on Empire State Weekly, I'm Ryan Peterson in Albany. We'll see you right back here next week. And don't forget, you can catch Empire State Weekly all over the state of New York. Here's our full schedule of where you can see us on 10 television stations across New York.